Why is blood glucose critical for flu and diabetics? Imagine fighting off a flu while your body's energy system is already struggling. That's what happens to many people with diabetes. When a diabetic gets the flu, their body responds by releasing stress hormones like adrenaline and cortisol. These hormones cause blood sugar levels to rise because they signal the liver to produce more glucose and reduce how well insulin works. This leads to high blood sugar, known as hyperglycemia, which can damage lung tissue and weaken the immune system's ability to fight the virus effectively. High blood glucose levels make the lungs more vulnerable. They impair the function of cellular pumps that keep the lung lining intact, leading to fluid buildup and inflammation. This can cause breathing difficulties and worsen respiratory symptoms. Fluctuations in blood sugar, called glycemic variability, also cause oxidative stress and increase inflammation, which further damages lung tissue and makes the flu more severe. These effects have been shown in studies using cell cultures and animal models, confirming that poor glucose control makes flu outcomes worse for diabetics. When blood sugar is uncontrolled during the flu, it can also trigger serious emergencies like diabetic ketoacidosis. This happens when the body produces excess ketones, making the blood acidic, which is life-threatening if not treated promptly. Another complication is hyperosmolar hyperglycemic nonketotic syndrome, where blood sugar becomes extremely high, leading to dehydration and confusion. Both conditions requiring urgent medical care and can be fatal if ignored. People with diabetes often have a weakened immune system, making it harder for their bodies to fight infections like the flu. The illness itself can cause blood sugar levels to swing unpredictably, sometimes dropping too low if appetite decreases or rising sharply due to stress responses. This makes managing blood glucose during illness very challenging. The interaction between flu and diabetes is bidirectional. The flu worsens blood sugar control, and poor control makes the flu more dangerous. Because of this complex relationship, keeping blood glucose levels stable before and during a flu infection is crucial. Following a diabetes management plan, monitoring blood sugar closely during illness, and seeking medical help early if symptoms worsen are key steps. Vaccinating annually against the flu and starting antiviral medications early can also help prevent severe illness in high-risk groups like diabetics. In summary, blood glucose is critical for flu and diabetics because high glucose damages lung barriers, increasing the severity of respiratory symptoms. Glycemic fluctuations promote inflammation and oxidative stress, worsening outcomes. Uncontrolled blood sugar can lead to life-threatening emergencies like diabetic ketoacidosis and hyperosmolar hyperglycemic syndrome. Diabetes weakens immune defenses, making flu infections more severe and harder to control. And during illness, flu can disrupt blood sugar regulation, creating a challenging cycle. Managing blood glucose carefully is essential for reducing the risk of serious complications from the flu in people with diabetes. Always consult healthcare professionals for personalized advice and treatment plans.